So during a consultation, one of the things I always let our patients know is whether you have a silicone implant or a saline implant, two things may happen. One is, what happens if they rupture? Well, the rate of rupture is about 5% over 10 years, really pretty low. So you're looking at 95% of the time you're going to be just fine. But if it happens, it's actually a pretty easy fix, and it does require going back to the operating room to replace the implants. But like I said, whether it's water or gel, these things are not harmful to your body. But it's important to know because it may happen even if it's 5% of the time. The other thing I like to let people know is a capsular contracture. So what is a capsular contracture? It's when you get hard tissue that forms around an implant. And it can happen with a silicone implant or a saline implant. And the body puts around the implant a very hard tissue which is abnormal. If that were to happen, what you feel as a patient is it feels a little bit hard and firm. Once we detect that, we do recommend going back to the operating room to remove the scar tissue and replace the implants. The rate of a capsular contracture is about 5% over 10 years. So again, both the rupture and a capsular contracture is about 5% over 10 years. Very low, but if it does happen, very treatable. A question that I get a lot is, how long do these implants last? Well, a silicone implant or a saline implant, the FDA does recommend exchanging them every 10 years. So it's important to know as a patient who's receiving these implants, they are not permanent. They're not meant to be there for the rest of your life. So if you're young and getting it in your 20s, you can expect to have an exchange sometime around in your 30s. That's an FDA recommendation. We follow those recommendations. So in 10 years, it's important to visit with your plastic surgeon to see if it's time for you to have your exchange on your implants.